So welcome again to one of my videos. I'm Iqbal Malik, and today I'm going to tell you about how to access the radial artery, which is the best artery for doing smaller procedures like diagnostic angiography and stenting. Reduced complications compared to femoral, reduced bleeding, a faster recovery, and really actually probably the standard of care across the world now. So we start by draping the patient, exposing the right radial artery. Of course, you can use the left radial as well, but I don't like going to that side of the patient. A small amount, maybe just 2 mils of lidocaine, just over the puncture point. Normally I don't use ultrasound, but if it's becoming difficult, then the ultrasound really does help define exactly where the radial artery is. It's small, the needle's not very visible on ultrasound, but nonetheless it can be very useful. But most of the time it's not needed. You can see I've punctured at about 45 degrees. If blood comes out and then stops or doesn't come out, then you can pull the needle back. So once the wire feeds smoothly, then you know you're not hitting the obstruction. It should go smoothly. And then after that, one can remove the needle. And at that point is when I make a small cut with the blade upwards, not downwards, because I have seen someone make a cut in the radial artery, which means that then it's difficult to stop the bleeding. And here's a glide sheath. I like the needle and the wire of the glide sheath, but other kit is available. And this slips in very nicely. You warn the patient of a slight discomfort. Occasionally there is spasm, but as you see here, it slipped in very nicely with no difficulty. And once we've got that, we clean away any slight amounts of blood and put a tegaderm on top to hold the side arm in position so the sheath doesn't move, and make again a cut so that you can access for your catheters. You can make a pre-cut if you want, but a cut afterwards is usually what I do. So there you have it. You have access, but you do want to flush the line. We're about to do a TAVI here, but so we haven't put heparin in just yet, but heparin and verapamil or nitrates will mean that there's less spasm, at least 5,000 of heparin if you're going to do that, and therefore we have access. Now at the end, of course, you want to close it. And normally what we do is put a stat seal on, which reduces the bleeding even further, and then put a TR band on. And the TR band ideally should be placed with an oxygen saturation monitor, as you can see here on the thumb, so that you get to a pressure where you still have a little oxygen pressure. So there you have it. There is another video about access to the radial artery. Join me next time for more cardiology.